what is coming next. But I haven't seen this yet. And if you ask how we do all these validation studies on these devices, we, after doing our in vitro examinations, we cut the teeth, we have severe sections of the teeth, and we are able to look at each section in order to see how deep is the caries really and how valid all the systems are. And all of the, many of the systems I showed to you has been already validated by our work group. There is another device, it's available in Germany, I'm not sure where else, and it's actually based on the same system, so you might see that nowadays each company has a device for caries detection on the market, and we are not able to use all of them or to test all of them. So this device, I just saw it, but I haven't worked with that yet. It's called Sopro Live. But what I would like to show you is, again, another system. So get away from all the fluorescence thing and go to the electrical impedance measurement. This is a quite old system, let's say, but the device is quite new. And it is based on the fact that normal hydrolyzed enamel has an electrical impedance, and when there is caries, due to a loss of calcium and phosphate, the pores are getting bigger and there is more water in the pores, and so we have another electrical conductance than sound enamel. And this electrical conductance can be measured by means of this device, which is called Caries Scan. It was developed in the UK, and it was introduced 2 years ago in Germany. And I'm not sure, but I think the company Vivadent Ivoclar is showing this device here in Australia, but I'm not very sure. And I also brought a short film for you how to use this device. For this device, you also need a dry tooth surface. When there's too much saliva on the tooth surface, you get a false positive answer. It shows you that it's dentin caries. And there are disposable tips, so you can use for each patient a new sensor. You need also a lip hook in order to get a circle of electrics. And after drying the tooth and after pushing a button to start the device, you have a numerical scale. Again, it's from 0 to 100, and it also shows you color on the device. This is again the way how it works, and with this device we did a clinical study in order to compare this with the Vista Proof in order to see which one of the devices have the better ability to find caries lesions. And what we found out that combining each device with visual detection, we have, let's say, over 90% of having all the lesions detected compared to the radiographs or to the clinical situation. And that was quite good. If we use the devices just by themselves, for the caries scan, we had better measurements for dentin caries, and for the Vista Proof, we had better data for finding enamel lesions. So you can see the devices are not always comparable, and depending on what you need in your dental routine and in your dental practice, you might prefer this device or the other one, if you prefer any device. The Caries scan can also be run by software in order to get the data stored, but there is no picture, no image, only the scores. But you don't have to use it. If you want to use it, you can download the software on the homepage, and then you can connect it to a computer via Bluetooth, the device, and then you can measure each tooth and store the data. And later on, maybe after 2 or 3 times, you can in terms of having caries monitoring, compare the data and show the patients, okay, 3 of your lesions has been arrested, 1 lesion has been developed more, getting more into depth, and informations like that. You can also print these sheets, give them to the patients, and so it's also, again, a good tool for patients' motivation and like that. And there is also an interpretation for these scales from 0 to 100, which is also not, let's say, 100% valid yet. With our in vivo study, we changed a little bit these measurements or this scale. So this is now this new scale which I brought to you. It's unfortunately only in German, but I try to maybe translate it. So we have figures from 0, or 0 is sound tooth tissue, 1 to 50 is indicating that there might be something in the enamel which should be maybe treated preventively. And when you have data from 91 up to 100, it is an indication that there might be a dentine caries. So they are always talking about it might be a caries or it might be the need for restoration, or so it's not very fixed yet. On the website, you can also find there is a protocol which I wrote. It's in German and in English, and how to use the device. There are many other devices on the market now. Some of them are not yet in Europe, so I couldn't take a look at them. Some are. I just want to show you 2 other devices very shortly. This is one from Morita. It's called Pen Viewer. Never seen that, just on the website. And the other one is Caries ID from Dentsply. And for this device, I just shortly had a review of a paper where they showed that this device had no ability to distinguish between sound and caries, sound tissue and caries lesions. So that's the latest information I have at this point. So maybe in some more years I can give you more information on that when we did the validation studies in our work group. Now, I showed you actually some or many devices, and the question is always, do I need all of the devices, or what do we really need? Do I really need this one and the other one? And another question is always, do I have to believe when the company comes to me and says, okay, this device is the very best and you have to use that in your dental practice? Actually, this is the way it works in Germany. So while you are drilling, someone from the company is suddenly standing in the door and says, hello, I'm here and I have the best device for you to sell it. So come and take a quick look at it and give me the money. And sometimes all of the devices are really quite the same. So there is just, on this device is one name of a company and the other device is another name of another company. So there is sometimes some redundancy, let's say. So in order to have a summary for all of these slides I brought to you, I would like to give you maybe an impression that which of the devices or which of the methods might be best suitable for which indication or which surface. So to me, in my opinion, and what I feel during all my clinical routine, I think that the visual detection of tooth surfaces, it tend to be one of the best systems we have. So it's quite good to use the eyes, even if you need magnification for some lesions, because it's easy to use. You can always use them. Use your eyes, of course, in the daily routine. And one good thing is that you can have a clear differentiation towards other, let's say, defects which are not always from caries origin, maybe erosion or maybe abrasion or enamel hypomineralization and things like that, which the devices not always might show you. For laser fluorescence, you can use it, of course, quite well at occlusal and smooth surfaces, but the tooth surface always have to be clean, so you cannot just check the patient or scan the patient quite fast when you don't have clean tissue. Tooth tissue, the same is with the fluorescence-based camera systems, and they are very good for occlusal caries detection. And what we found out since the last 2 weeks where we are in a clinic, that we also can have good results with buccal lesions. And you can store the data, you can store the images, and you can also do a plaque diagnostic. With the electrical impedance measurement, it's, let's say, only suitable for occlusal lesions. I tried them on smooth surfaces, doesn't really work, and approximal doesn't work at all. And radiography, at least, is in some cases, let's say, still the gold standard towards having the option whether you want to do restorative treatment option or when you have to do an endodontic treatment. So you can see the pulp, you can see where the pulp is, and you have maybe many other informations as well. So for my last slide, in German we will say take-home message since some years. Let's say that we know that the modern dentistry is preventive or minimal invasive, but in order to get access to tooth surfaces which need this preventive or minimal invasive treatment, we have to find them. And we can only find them when we use difficile methods which not only show the caries on a detection level, but also the caries on a starting level, on an initial level. And there are many ways to do that. We can have it with visual systems. We can also use devices and tools. One good thing with the tools is for the patient that there is a good interaction. We can talk to the patient, show him the pictures, tell him the interpretation of some data. But it's also good not to be, let's say, addicted to any tools and to rely on the visual detection. And if possible, or if you need, then you can use any other devices in order to get more secure for yourself or for the patient. And at the end, it's, of course, not only caries detection is a matter, but also the caries risk assessment, which makes the thing a bit complicated, because not always when we have maybe, let's say, ICDAS 1 or 2 lesion, we might also need operative treatment in one case, but in another case we would need them. So it's not always the tooth we are looking at, but there's always a patient which is, let's say, hanging on a tooth. And so this is my last slide, and I would like to thank you very much for your attention.
For this lecture. I would like to thank you very much from JCU, and I'm very proud to present you a little present from us.
Thank you very much. That's nice. Thank you. Thank you.
But before we go home, are there any questions? No questions?